Well, it's an issue all parents have to deal with, potty training their children. But a growing and somewhat controversial technique known as infant potty training suggests the process should begin as soon as birth. Laurie Boucke is the author of Infant Potty Training and the producer of the DVD Potty Whispering. So Laurie joins us now, and as a parent of two and a mother of one still in diapers, I would think that I would have to quit my job and devote my life to holding my infant over the potty. I mean, I don't know how you do it. What are you going to say to me and to other parents who say, that's just too much work?
Well, I would say that this does not have to be a full-time endeavor. And I have a chapter in the book called Part-Time Pottying. Most mothers are working nowadays, and so you can do this part-time. You can take your baby to the potty or the toilet in the morning or after work in the evening and on weekends, and that's sufficient.
What's the advantage? What's the benefit to doing this versus having them in diapers for the first 2 years and then starting the process?
Well, there are advantages for the babies and the parents and the environment. So you want me to talk about the ones for babies first?
Whichever one you think is the most important.
Well, I think for babies it's nice because they are aware of elimination from birth. You can tell this if you just watch a small infant. It's pretty obvious when the baby's having going to the bathroom. They're straining, they're turning red, and you can tell, and the baby's aware too. And then we slowly but surely teach it, just use the diaper for a while, and then after a while they learn that's where they should go, and it can become difficult to unlearn that later in life if you don't start till they're a toddler and they're more independent. It also keeps the babies nice and clean, helps get rid of diaper rash. We do use diapers. It's not a totally diaper-free thing throughout the whole period, but we work towards becoming diaper-free, and we give them time at home. If we're at home and have the time, we give them time in little training pants, or some mothers let them go bare bottom for a little while just to help them keep that awareness. And also, there's no diaper bulk, so babies can, for example, turn over sooner in life than if they're wearing a diaper.
And I want to read a little bit of advice, I'm sure you've read it before, that comes directly from the American Academy of Pediatrics website. They say children younger than 12 months have no control over bladder or bowel movements and little control for 6 months or so after that. Between 18 and 24 months, children often start to show signs of being ready, but some children may not be ready until 30 months or older. Is there a concern at all that forcing the issue might be detrimental to a child's development?
I think if a parent is using force and is using punishment or pressure, that it is detrimental, but we don't do that. We have a list of no-nos. There's no punishment, there's no pressure, there's no coercion, there's no shaming, things like this. We're not doing this to rush toilet learning. We're just doing this to stay in sync with our babies and help them with a natural bodily function. And I've seen hundreds of babies, including my own, who do have control far before 12 months. So I don't believe that. There has never been a study actually proving that. We don't have any in-depth studies saying that babies have no control before 12 months, but that's what's believed in this country. However, in Asia and Africa and some other parts of the world, they've always trained their babies from a few weeks old or a few months old, and they know that their babies have the control, and a lot of it has to do with our attitude. If we believe our babies have some ability to be aware and to learn to control the muscles a little earlier than if we totally ignore it, then they're able to do that.
Well, Laurie Boucke, very interesting. Thanks so much for joining us. We appreciate it.
Okay, thank you.